Welcome to our short film, or TikTok, or whatever you choose to call it. My name is Nate Unthank.
And I'm Xavier Thomas.
Our social science topic is soda taxes, and we will be diving into the realm of their use. As you watch this video, keep in mind the question, do soda taxes work? If so, what is the impact?
We used evidence from research studies and real-world examples to build our argument that soda taxes are an effective public health strategy for reducing sugary drink consumption, which is linked to various chronic diseases like obesity, diabetes, and heart disease.
The World Health Organization defines public health as the science and art of preventing disease, promoting health, and extending life through organized efforts by society. Public health efforts are focused on populations, not individuals or diseases.
Soda taxes are a type of public health motion or a movement to make our society healthier. This is intriguing because soda is a very common thing within our society, and almost everyone you know drinks it regularly or has consumed it before.
In a study conducted in 2023, researcher Selena Gangle described soda taxes as, "These taxes aim to increase the soda price and reduce soda consumption."
Which soda can be a significant risk factor for non-communicable diseases such as obesity and type 2 diabetes. The overall idea is that these taxes will reduce these diseases and make our people healthier.
Soda taxes do in fact relate to the social determinants of health. The consumption of sugary drinks is often more prevalent in low-income communities due to factors like marketing, affordability, and limited access to healthier alternatives.
Social determinants of health are non-medical factors that influence health outcomes. These are shaped by forces and systems that are beyond the control of the individual. In this instance, with soda taxes, it impacts people in low-income environments.
This is proven in a 2020 study conducted by Stephen Seiler, researching soda taxes in Philadelphia.
The research paper reads, demand in the taxed areas decreases by 46% in response to the tax.
From using that soda tax, the demand for the product went down, resulting in less consumption, which undoubtedly then leads to less amount of these non-communicable diseases like obesity and type 2 diabetes, like we aforementioned.
Stigma is a public health factor that can also be associated with soda taxes and individual health behaviors, and how policy interventions like this may help shift the focuses away from the personal responsibility to structural changes that promote better health for all.
Stigma is when someone sees you in a negative way because of a particular characteristic or attribute. In this case, soda taxes could help shift social norms by making sugary drinks less socially acceptable over time, which is an odd thing to think about, but it will work. As taxes increase, society may come to view soda consumption as less desirable or more stigmatized, which could lead people to reduce their intake or avoid it altogether.
Stigma works hand in hand with other social determinants of health, all factors to our collective public health.
Another accredited peer-reviewed article, this one from Springer Nature and author Brian Boldinger, it reads, tax pass-through is estimated to increase with realtor distance from low-tax borders, reflecting cross-border competition among consumers with relatively low cost of tax avoidance.
In other words, if a store is close to an area with lower taxes, they might not raise prices as much because people can just go across the border to buy cheaper. But if the store is further away from a low tax area, they're more likely to raise prices because it's harder for people to go elsewhere to avoid the tax.
A 2010 article from Health Affairs further proves that income and social environment is greatly impacted more by soda taxes. The quote is that subgroups of at-risk children who are already overweight, come from low-income families, or are African American may be more sensitive than others to soda taxes, especially when soda is available at school.
We see how much a simple tax on soda affects our society so much. Its success depends on how well people adjust to their behavior or whether the tax is high enough to make a noticeable difference.
A tax at its core does mean that the price of an item will be raised, even if this is something minuscule as is soda. However, not just consumers are spending money on this issue.
In the past 4 years, soft drink companies have spent about $5.9 million lobbying California lawmakers and giving to their campaigns to favorite charities. That is from a 2021 study in the Desert Sun that calculated that number.
But the consumer is spending more money for this simple drink. The tax policy briefing book speaks on this vice versa sense. The publication reads, Tax cuts increase household demand by increasing workers' take-home pay.
That idea is basically the foundation in the constant battle that lawmakers and public health officials have to deal with. It is worth the money for this action to make our citizens healthier.
In conclusion, soda taxes represent a promising public health strategy to reduce sugary drink consumption and address the rising prevalence of non-communicable diseases like obesity and diabetes.
By examining the impact of soda taxes on different populations, particularly those affected by social determinants of health, we can see how these taxes not only promote healthier choices but also create a shift toward improved public health outcomes.
Xavier and I thank you for watching.